It is December 2nd. We want to welcome you into Coronavirus Inside the Arizona Numbers, where we take a closer look at the data coming out of Arizona to help you make the best decisions for your family and your life. You know their health and tendencies better. We're just here to walk you through the data as it comes out of Arizona and help you better understand how things look for us here in our state. A lot to talk about today, Garrett. We had a lot to discuss yesterday with that high number of 10,000 cases coming out of Arizona and giving people some perspective on what that means and what days that came from. So today we're looking at 3,840 cases, but we will start where we always do on the Arizona Department of Health site that helps us get a little better understanding of things.
So as you can see today, about 3,840 cases were added to the ACDHS report, 52 deaths, pretty high death number. That 3,840 is more in line with where, say, if we didn't have a Thanksgiving holiday, we would have expected this number to land, say, on a Tuesday. Tuesday probably would have been like 4,500, but things would have been a little different from there. But what this suggests right now, but of course, the 7-day average has gone down slightly, but we could absolutely see that happening because yesterday's report was so massive that it was going to pull the average down no matter what. But the 7-day average for deaths is going up. It's at 30.7 right now. Let's take through. Let's show where the cases went. We were talking about this yesterday. How more could be added to what is now our peak day. You can see about 100 or so cases were added to this. It's now at 5,630. But you can see this is what we were talking about with that 10,000. We see. You don't see this massive spike of 10,000 cases because this is the date of collection. So you can see it's being sort of folded into these weeks. This day is now much higher than it was yesterday. This day is much higher than it was yesterday. Mm-hmm. And I expect both of these days right here, November 25th and the 26th, to get close to this or surpass this 5,630 as we get as we keep moving on to as we get more reports coming in. So we'll see how that happens or how that works. But all in all, today was, I guess, more of an expected day as far as numbers from a numbers perspective.
So, Garrett, when they're plugging these back in on the collection date, so on the date that the sample was taken, how many days are still uncertain? Are we going back about 4 more that need to have cases added to them, or how much is that lag?
Yeah, it's about 4 days right now. So okay. Really, we're looking at anything from it's interesting about that calculation. So that means then the previous 4 days are where the majority of cases are going to be coming in. So that would be from like Saturday the 28th to today, and tomorrow it'll be from Sunday to the next day. However, there's still going to be, after that period of time, there's still going to be cases added in much smaller increments. There might be, like I said, about 100 or so added in that small time frame. I think I have it where I detect case lag by, I think it's 97 or 95% of the cases have to come within that time frame for the lag to stop. And then whatever's left of that 5% can be distributed anywhere else on the curve. So that's sort of how it works. Most of the cases, the vast majority, are coming within the 4 days, but there still could be some cases coming after that.
Okay, so far in the history of this pandemic here in Arizona, our highest date of diagnosis or collection for diagnosis was on Monday before Thanksgiving. Now, it looks like, what's the difference between Tuesday and Monday? Tuesday could still have a chance of passing that.
Yeah, 5,386. It does have a chance of passing, like I said, even though we're adding, 4,000, 5,000 cases. When you think about that 95%, obviously 100 cases can still sneak in into that day and creep up to about 5,600. So there is still a chance that, say, our peak date is not that Monday, that it could
right, somewhere in that week. Yeah. Okay. So we'll get to a lot of the questions in just a little bit, but I did see Carol asking whether the governor is going to be speaking. And Carol, he's going to be speaking at 3:30. And to all of you, what we will do is we will stay with you until that point here, answering your questions and getting you the best information and numbers that are coming out from the state. And then we'll switch over so that we can all find out what the governor has to say. Do we have any hint at this point here in the newsroom? We don't. He could be talking about rolling out these vaccines and how that would happen, how that would take place. There are some mitigation strategies that we told you about were voted on last night. I believe it was after our live stream, actually, Garrett, that they decided in Tucson to start a curfew. The proposed curfew was to start at 8 p.m., but they ultimately decided to start it at 10 p.m. till 5 a.m. in Tucson. It starts this Friday. It goes through December 23rd. So just to update any of you watching from Tucson or any of you who travel down there for work, that goes into effect on Friday. So we don't know if the governor's going to match something like that. We don't know if there's any shutdown coming. We don't know. We'll have to wait and see. We'll have to be patient for 35 more minutes. So we'll let you know, and we'll be here with you to get you right into that live stream. Okay, so Garrett, we discussed the cases here in Arizona and how things look case-wise. The numbers and the death reports that came out today. So always sad, no matter the time frame in the pandemic, but incredibly sad over this weekend, because that means that these Arizona families lost their loved one probably in a recent time frame, being over this holiday. So we pause to think of them as we begin to look at this. But in the same sense, it's reported in 52 cases today, 26 of those in Maricopa County. But then just like we showed you all with the collection samples, they get plugged back in on the date of death in this case. So in the life of this pandemic, help us better understand at this point where we saw the deadliest day. Did that still happen in July, or is this a recent development?
Yeah, let me go over to that really quick. My sorry, I was going to pop something up for you, but my COVID-19 script is not working.
That's okay. People are writing in the comments. Garrett is the man. Angel's writing that right now. So don't even worry if it takes a second to pop that up.
So we'll look
Angel,
at
thank you.
So as we've talked about, yes, right now the peak date of death is still back in the summertime. Here's the curve, the Epi-curve for the deaths, and you can see the peak day occurred on July 17th at 103. And in fact, we are just now sort of getting to numbers that we were at in May, June, basically until about this point in early June. So our numbers are creeping up, but as we can see, as of right now, these numbers haven't filled in, so we don't know exactly yet. Let me just back this up really quick. You know, there is evidence that the death rate for this has gone down, and that we even with these higher case numbers, that we won't see death rates that come to this level right here. There's some evidence to suggest that, but on the flip side of that, because of how deaths work, very sadly, usually takes about 28 days or so for the entire progression. If someone passes away from COVID-19, it can take 28 days from the case onset. So we don't really know, and we won't really know until, say, late December, early January, if this curve right here is going to continue to fill in. We just don't know. Yeah, and then, of course, we talked about, because of the way that the research works, they also are added to the curve at a later time as well. It's not 4 days. It can be as high as 20 days. So we're talking almost a 2-month time frame for these death numbers to fill in properly. So we just don't know yet.
Yeah, and when we look at this and we talk about that perhaps we are getting better at dealing with this virus and knowing how to treat it. Let's remember at the beginning of this thing when we were seeing a 7% death rate in places like New York and New Jersey as this was approaching there. And so to pull these numbers down to even 2%, the current case fatality rate in Arizona for all age groups total is 2%. Now you break that out to over 65 and it's a very different story, and you add in comorbidities and things like that, and it's very, very different, but 2% so far is much better than the situation we were in at the beginning of this. And as we talk about all these numbers, I say it every time, Garrett, we remember that there are people behind these. I'm seeing Donna, your comment on here. Donna writes, my boyfriend died July 16th from COVID-19. Donna, I'm so sorry for your loss, and all of those families who are grieving a loved one right now. So all right, Garrett, there's a few more things to highlight on the bottom of this sheet that helps us better understand that the age groups I was just talking about there. There's that 65 plus category you see with, right. It looks like it's over 4,000. Yes.
So this is the age categories. You can say obviously the vast majority, 72% of the deaths that have occurred have come from the 65 plus category. And then it's the next one, 16%, 7% for 45 to 54, 6% for 20 to 44, and then less than 1% for under 20. That, just so everyone knows, this was 9 yesterday. So as of right now, AZHS is currently researching someone who died either in this time frame or this age group, this age group or this age group, because I have seen this go to 10 and then it gets reassigned to the 20. So, but there is, sadly, since there is someone who died from this that's quite young and it was recent.
So sad to hear that. And Kimberly writes, yeah, they know how to treat it better to reduce deaths. So that is the silver lining in all of this. And that's why we talk about the science evolving in all of this. We start to learn about this virus more, which is why it was so concerning in the spring bump that we saw, that we didn't see as much here in Arizona, but across the rest of the country and obviously around the world. So also in that 65 plus category, the deaths in our long-term care facilities just here in Arizona are currently at 1,316. So that is why the priority is to vaccinate those in the long-term care facilities first, and of course our caregivers out there.
I want to address Michael Burstein here. He's saying that we should acknowledge those who committed suicide or drug overdoses due to COVID shutdowns. And Michael, it's not that we're not acknowledging this particular data point. It is a data point that is only really available when the AZHS publishes an annual report for mortality statistics. So there is, as of right now, we don't have this number. And eventually we will have this number, and then it can be analyzed. But until that report comes out from AZHS that has these mortality statistics that are broken down by certain things, we just don't have it. So, it's not that we're avoiding this number. It's not that we're, not going to acknowledge it. It's just that we don't have a way to analyze it.
Yeah, and for a little background for everybody, that's from the health department in any category. The information that we get out, a whole file is written, whether it's childhood drownings, whether it's the flu, whether it's suicide, death by suicide, that comes out about 2 years later. So if you go through, if you want to do your own research on a specific topic outside of what we're addressing here in coronavirus, you can find those reports on the Arizona Department of Health website. Whatever issue that you're interested in learning more about, the most recent ones you're going to see are from about 2018, those reports. Now, they give some initial data that comes out that you can look at. It's tough to analyze if you're not an epidemiologist or you're not a data person like we have here with Garrett, but you can find those numbers there. So if that's something you're interested in, that's where you can find that. But for this 45-minute to an hour chat that we have here each and every day, it's about the numbers related to coronavirus, because this need is so urgent and it's affecting all of our lives right now as we try to make changes to either get this thing under control or to make sure we're protecting our loved ones out there. Jennifer, thank you. She's writing, we're so thankful for your daily update, as we couldn't get this information anywhere else. Jennifer, thank you so much. It's been our commitment to try to do this. I got a lot of questions about understanding this data back in May, and I thought maybe we should start some little videos. I didn't think it would turn into this, that we're here an hour every afternoon with you, but thank you. I hope that you guys are learning something from it and you're better able to protect your family. Okay, Kristen's asking about ER visits, and I do want to get to those numbers for her and some of our hospitalization numbers that are coming in. Currently, I know Kristen's asking about ER visits. I'll give you a second to pull that up, Garrett. Currently on ventilators in our state, 369 people, and currently in the ICU, 579 people. So that gives some perspective as you pull up that emergency room visit.
Yeah,
chart.
as you can see, we did have a significant spike in emergency room visits for COVID-19. That occurred from yesterday to the day before. So you can see we had 1545 and 1864 right here, which is the second highest number of COVID-19 emergency room visits that we've had during the whole course of the pandemic. It might be the third highest. Sorry, yes, it's the third highest. But so we had a pretty big spike there, and it is also reflected in our whole census data. Excuse me, that's not the right one. We did have, if you look at the emergency room data here, this is a record for all of emergency room visits, emergency beds in use. Excuse me, this is the bed count. We had a record bed count yesterday as well. So
record beds in use for COVID or for all
all. That's
usage?
all.
Okay.
That number's all. There's a bit of a difference just to understand these two numbers. So this emergency room, this is COVID visits. So these
Right.
are people that went to the emergency room. It was determined that they were visiting for COVID. These are not people that were confirmed positive, but they had the symptoms that have indicated that they were a COVID patient. And so this is the visits, whereas the other one is a bed count. So they are two different numbers completely. It's only going to count a COVID person that is in a bed if that person is in a bed at the time of the bed count. So that's just very important to know how that number works.
Yeah, for sure. Thank you.
As far as the other hospitalizations, let me go through them really quick. We did have, hold on, I'm going to, okay, so on inpatient, we're looking at about $26.99. That is up, and it's up to about July 24th. That's where that data, that's the most recent that it was at. Ventilator use, as you said, 386 ventilators. That is, I believe, August 7th is the last time we had a number that high. ICU beds up to 642, and that number is as high as we had it on August 1st. Discharge was a record, the most number of COVID-19 discharges since the pandemic began. And then we already went over emergency room, and then also almost a record, second highest number of intubations in the ICU.
Okay. And Garrett, I want to let everybody know in the comments too, you should be able to get free testing for this. A lot of people were asking about where to go to get tested. Just go to the site, ADHS site. So the Arizona Department of Health Services site, and sign up there. It should be absolutely free. You don't need to pay for this. You can go get a free test, whether you are curious or whether you are feeling symptoms. That should never be a barrier, neither insurance nor money. So that's where you can go to get signed up. The saliva test is what I've taken a couple times. I find that one just to be the least invasive and the easiest, although one of my kids had to do the full nasal swab. So, you know, whatever works for your family. I'm seeing Jenna post, I'm in the CVS line right now to be tested. Not too long of a line. That's good news, Jenna. Hopefully you're going to get good news soon.
I saw someone else ask about the COVID-like illness metrics for tomorrow, as far as can they go above 10 for at least 1 week? And the answer is they can. They could. There is a chance that the metrics tomorrow, that when Maricopa County releases them, that the COVID-like illness will be above 10%. I don't know what that number is going to be, but it could be at this point.
So, and I highlight that 10%. That's a concern because any remaining schools that are open at this point rely on that data, or I'm assuming that's why they're asking about that 10% threshold. Yeah.
So after if they don't make that 10% threshold, if a school district doesn't make that, then technically at that point they're out of, after 2 weeks, they're then out of compliance with the guidelines that the AZDHS puts out and completely. So because right now they're outside of the compliance of 2 of the 3 metrics. After 2 weeks of over 10% on the CLI, then they would be out of compliance for everything.
Yeah. Okay. Katie writes a nice comment. I'm sorry for your kiddo, Katie. My son has to have a full nasal test for surgery coming up too. I wish I could do it for him. Yeah, that's Katie. That's exactly what I had to go through. I sat in there with my child, a full nasal swab for prep for a surgery, and that's all passed now, and you'll get through it. But I know how stressful that is as a mom. So I'll be thinking of you over these next few days. Okay. Some of these other numbers that we've talked about, and Garrett, I think this was last week that we discussed this idea of a shorter quarantine, and that was discussed even more today, and that those regulations, if you will, are it seems now being enacted. So 7 days with a negative test, or 10 days with no symptoms, instead of that 14 days that we talked about. So we kind of gave a hint of that last week. I just wanted to follow up on the new developments on that side of it. Okay, so how many active cases then do we have here in Arizona at this point? I have to imagine with these numbers that it's increasing pretty fast.
We have anywhere, and this is active confirmed cases, anywhere from 50,000 to 90,000. That's sort of the range. Probably closer to that 50,000 right now, but still it could be within that range of 50 to 90.
Yeah, pretty high number though for
at one point it was as low as, I think it was
20, 18.
Yeah, I think it was less than 20,000. Yeah.
Yeah, so it kind of puts it, and it wasn't that long ago either. It was what, September, I'm thinking
September, yeah.
we were at that point.
Mhm.
Okay, so it's sort of puts it in perspective. The dates with, or the dates, the states rather, with the highest number of cases that came out yesterday. I always highlight these for you, sort of the top 5 across the country, so you can just kind of track or reach out to friends and family who might be in those states. A pretty different list today: California, Illinois, Texas, Arizona, and Ohio. Now, I'm assuming we made that list because we had such a
Yeah,
high
10,000, yeah.
reporting day yesterday that pushed us up in this. One of the other numbers that is greatly affected by that 10,000 number is our not in our RT. So for people who are jumping on that every single day, taking a peek at that, it's not as stable as it has been in the past, Garrett.
No, it's not. It's at 1.04 right now, but I don't believe that for a
Yeah.
second. I think this is taking it's taking too much. It's ingesting too much information from the Thanksgiving lag,
Mm-hmm.
and that's causing it to be very noisy right now. So I really think we should go back to the RT about sometime this on Tuesday or next week or so. That's when it should start to clear up and start being what it should be.
That it'll have stabilized a little bit
Yeah,
more
I
to
think
give
so.
us an accurate read.
Mhm.
Okay. ASU just giving an update a little bit ago, and I want to update all of you on that. We don't have the exact breakdown, Garrett, of ICUs that are filling up specifically right now. The number we're pulling is the general number of all ICU beds,
Right.
correct?
Yes.
So ASU just reporting within the last hour that they say 11 of the 82 ICUs in the state are full. So they're getting a little bit more specific on that number, but it certainly puts it in perspective if you're needing to go to the hospital for something else and sent into one of those ICU beds. We see from these case numbers about 8% of the cases that are diagnosed here in our state do end up in the hospital. And 1%, Garrett, we're going into the ICU. Is that still how those numbers sort of look?
Yes.
And why that 10,000 number or today's 3,000 so I'm sorry, 3,800 number is so concerning, because if you take 8% of that or even 1% of that, you see where we need that wiggle room coming up to house everybody in these beds.
Yeah, and we touch on this all the time. The problem with the hospitalizations is, because I saw someone comment here, and they don't need to bring up the comment or anything, but it was like, well, not all hospitalizations are COVID hospitalizations, and that's completely correct. I'll bring it up just to show everyone really quick. We go over this pretty much every day, but we'll go over it again. Yeah, absolutely. Not all ICU. We'll start with ICU. Not all ICU are COVID-19 ICU. In fact, only about 37% right now.
Mm-hmm.
In ICU are from COVID-19, but as we've talked about, COVID-19 requires much more staff. It requires isolation from other areas. It just takes up more hospital resources. So as this number increases, it puts a lot more strain on the non-COVID parts of the ICU, and it creates a problem. And for the staffing, the specialty staffing that's required, I think that's one of the things that Ducey's going to address today, because I think the biggest fear of the doctors that I've talked to have been the staffing and not necessarily the beds, because we don't have that pool of staff that we had back in July, where we were bringing in people from New Jersey and other places to help us with our ICU and with our other COVID-19 issues. We don't have that this time because everybody's got issues right now.
Yeah. Not like what we saw in July, where we could pick and choose and fly people in from different states. I want to update all of you that in about 15 minutes, once again, we're expecting to hear from the governor. At that point, we'll sign off and turn this feed over so that they can keep you updated on any changes or mitigation strategies or vaccine rollouts. Any of that information will come in about 15 minutes, and we'll switch over at that point. One of the questions that's coming in, and I'm still getting this a lot from a lot of people, Garrett. So I'm thinking, let's go over it one more time and help people really understand this. Matt writes a good question. Is this an accumulation of numbers from several days because of a holiday or one single day of testing? The information is unclear and therefore makes it suspect. So Matt, we are so happy to help, because this is what keeps coming up, Garrett. This is how this is confusing for folks. So what we have is collection dates that could be any time. You could go Monday, Tuesday, Wednesday, any day before the holiday, let's say, because I'll just use that for a frame of reference because so many people went during that time. They go and get the test.
Yes.
The test numbers are reported publicly. So that's the number we release to all of you because we are waiting for those to be plugged in to the date of collection. When that's all plugged in, then we can go back and look at a deeper chart. Now, that's a lot to get into during a newscast. So we update the case numbers, but can we show him sort of like the 7 days or something that helps him? And I know so many others are confused about this, so this really helps.
Let me bring this up. This is this is our sort of internal metrics that we use. That I send to the newsroom every day, but I can show this, of course. This is the Epi-curve. So as he said, is this one single day? No, absolutely. The 10,000 was not on one day, and today wasn't on one day. This light blue, I know it might be a little hard to see, but all this light blue, this is the where the cases were added. Okay, as you can see, a tiny bit of the cases were added over here. There were some cases added last week, but most of the cases were added about 36 hours ago, and then from about 3 to 4 days. That's when most of these cases came in, and this is when their tests actually happened. And this is where you can see that here. So you can see in this case change by week chart, you can see that of the cases that came in today, 1,400 of them were added on the week of 11/29, which is this week. 2,100 were added the week of 11/22 to 11/28, and then about 190 came in on 11/15 forward. And then, as you can see, there was a tiny bit of cases that were added in October and early November, and then even some duplicate correction that happened out here. So most of the cases are being added early or very recently within the last 2 weeks.
So Matt, I hope that helps to better understand. And if anyone else needs clarification on that, let us know. That's the reason on the newscast we say, whatever the number is, 10,000 cases reported in today, because it obviously it's so cumbersome in how to say this, but there's no shorter, more succinct way to explain. Right. Then when we get all the numbers, we go plug them back into the collection dates, and then that's how you see how they look over the entire curve. And that's something you tweet that out pretty often, though, Garrett.
I do. I at least once a week or so, I try to put out the Epi-curves just so that people understand it. I did put it out yesterday because of that 10,000 number, so that was the day it really had to go out because it does cause a lot of confusion, but we try to put them out as much as possible.
Yeah. So Matt, I hope that helps. If anyone else again has questions on that, that's specifically how that works. So it's not just the holiday reporting, but because the holiday's in there, it sort of messes with what numbers we get in at which point. So what time frame the numbers are reported into us. It in absolutely no way changes the collection date. That is still put back in on that date, so we can then look at an accurate curve. Matt's writing thanks. So you're so welcome, Matt. I get that a lot. So from people asking over this weekend, I can't tell you how many people text me and said, "Wait, what in the world?" And I thought, oh gosh, let me get into work and let me help everybody understand this 10,000 number, because it's not what it seems at this point. And let's put it on the curve and see. So it'll be interesting to see, though, Garrett, what day ends up being the most tested day, if you will, because so many people ran out before the holidays. And so, something we kind of talked about, I think it was yesterday, a lot of people who tested before the holidays were sort of trying to test their way into feeling comfortable to seeing family. Yes. And then a lot of the tests that are coming this week are going to likely be more symptomatic, or people who are concerned or hearing they were exposed by someone that they were with.
So that November 23rd, the day that has the peak day, is also the peak testing day right now, which is 30,631 cases. So, and that is Monday, just before Thanksgiving. So as you said, a lot of people went out and got tested prior to the holiday to see if they could move or not. Yeah.
And so there might have been a lot of disappointment when people thought they were the healthy and they went in and took that test and then found out that, I'm actually an asymptomatic carrier, and that's really concerning. Dr. Burks had said that under 35 asymptomatic carrier was of a huge concern in this. Okay, so let's talk about how many tests have been given here in Arizona. It's in the millions at this point. What is it, like 2.5 million tests have been taken here in Arizona?
Yeah, let me just get that number. The number is, I'm just trying to get all the information. Where is it? Come on. All right. Sorry.
Because our capacity,
it's 2.3 million. And it came back. Let's see. Again, we're at about 16 to 70% in our positivity rates on a daily basis right now. Our average is about 14%, and when the week is done, it's going to be probably close to 14% is what the week will show.
14% statewide.
Yes, correct.
Okay. Okay. Yeah, and you do the breakdown by county too, if people are interested in that.
I'm running over to that as well at the same time. So let's get that. I actually had it and ready to go because I figured you'd ask something about that. So
get the alt tab ready to switch between those screens.
We did have, there were mostly double digits again today. We did have some lower numbers in Coconino County, only was at 8%. Greenlee and La Paz, two very small counties in Arizona, were both at 0, so they didn't conduct any tests, or if they did conduct tests, none of them came back positive. And then, but we did have things like Yavapai County was at 26.7, Apache County 25%, Grand County 22%. So we did have several counties that were in the 20s, as far as their tests that were reported yesterday.
Yeah. Okay, Kim is asking, so are they counting the antibodies as positive? I'm thinking she's saying as a positive test.
Not anymore. So that's been for a while now. Early on, the definitions from the ACHS did allow for a probable positive from antibodies, but once the antigen tests were released and widely available, they rewrote that and basically said, okay, now that's the third tier. We're really antibodies. We're not even really going to consider at this point as probables. We're just going to do the antigens or the PCRs.
Okay.
So, yeah, it's not no more antibodies as positives anymore.
Okay, so hopefully, Kim, we got your question answered in that. Such an interesting study coming out, I believe it was yesterday or the day before, and we didn't get a chance to talk about it, but they went back and looked at blood donations in December here in the U.S. and were able to test those blood donations for antibodies. So to see if someone was sick with coronavirus before the date we thought it arrived here in the United States, and they were finding it in some of those cases, which is strong signaling that it was here even earlier than anyone thought. And it was popping up in some pretty interesting states too, places like Iowa and Michigan. So it wasn't necessarily New York or Seattle, Washington State, like some of the hot spots that we saw. So what a fascinating way to find that information.
I mean, anecdotally, I had at least 3 or 4 members of my family that live in California that could all point to a sickness in December or January that, like, once everything knew about COVID, it's like, yeah, this really felt like COVID. Or, when you list the symptoms off, I had X amount of these symptoms. So, I just anecdotally know that I had a couple people in my family that likely had it.
So fascinating that they would be able to do that Nancy Drew type science in there and go figure that out. I think I'm dating myself by the Nancy Drew reference. Okay, so I want to remind you guys we're about 7 minutes away. Kim's writing, just curious, thank you. We're about 7 minutes away approximately from the governor speaking here in Arizona. So when that happens, I want to let you know that for those of you who are watching us on Facebook right now, we will continue to carry it live here on our Facebook page. We'll also carry it live on ABC 15. We'll have it live on our ABC 15 mobile app. So really, wherever you are, you can catch it. So we want to make sure that you get that information and that we sign off with you, even if we're a little truncated here today, to be able to make sure you know what's happening. Bridget writes, Nancy Drew is awesome. Thank you, Bridget. Remember those books? All right. Let's see. As we're getting ready to hear from the governor, we have just a few more minutes then, Garrett, to touch on a few more things.
Let's touch on one thing that I found interesting. Let me see if I can pull it up quickly. I wanted to touch on the mobility. Because what is interesting is that mobility, at least the mobility index, is in a free fall right now. And it's very interesting because
meaning people are staying home now.
People are staying home right now, and I don't know. And again, I can't quantify as to why this is, or if this. Here's the other problem with this: is I can't look at 2019 data on mobility index because it wasn't available. Because with an index, you need a starting point, right? Mm-hmm. Baseline. And with our baseline, when we look at indexes, is anything prior to, I think, March 1st, when there were no shutdowns. So that's the index baseline. So I have nothing to compare it to for 2019. But let me just show you what this looks like for today. Here,
What I'm curious what everybody's thinking in the comments. What are you thinking that is if the mobility numbers are down, and I'm asking you who are all weighing in on the comments here. Do you think people are sort of getting the message? Do you think hearing that number 10,000 made people go, ugh?
Yeah,
even if they didn't understand what that number meant yesterday, they were like, I'm staying home, or what do you think that is?
yeah. So yeah, because this is interesting. So this is obviously everybody heard, travel. Everyone's going to travel for Thanksgiving, and the travel is going to be so much higher. Blah 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 blah.
Mm-hmm.
And that is the exact opposite right now. This pretty much accounts for all of Thanksgiving weekend, starting from Monday. So Monday is both travel days at this point are accounted for in this graph. And like I said, as you can see, it literally dropped to its lowest level since September. And it had been climbing, and it just went into a free fall. And it's the fastest drop that the mobility index has had since the very beginning of the pandemic. Obviously, as you can see, this is the baseline. This is what I'm talking about. This is the baseline. And then it drops to, almost nothing. But while this is not a significant drop compared to this, it still is a bigger, quicker drop than any of the others.
Sharper. Mm-hmm.
Yeah, it's much sharper.
Yeah. I just saw a really, really good question. And I want to make sure I get to that. Oh, Tori's writing, working for the airlines, we usually have a huge drop off from travel from Thanksgiving to Christmas. Oh, interesting. Not just seeing people traveling for the holiday and not in between, I think is what she's saying there. Is it Jody?
That would be accommodated after this. So this is Thanksgiving.
Because that's not even showing it yet, is what you're saying.
Weekend. We're not even showing it. This is literally, I think the last day I have is 11/29. So we still have, this is Sunday, essentially. That's right. That's the last day I have. So, we're not even going into really post Thanksgiving yet. That's coming up next.
Okay, we'll watch for that. Jody has a good question, and I want to make sure this is along the same thing that Matt was asking, so I want to get to her question. She writes, so why does the Arizona Department of Health website show 5 deaths on November 30th? So I think what she's confusing, and to clarify this, when the date reported comes out, that's different, Jody, than the actual date of death. So if we're saying today, let's see, today we've sadly lost 52 people here in Arizona, you will not go to that that chart that you're looking at and see 52 on there, because those are plugged back in on the actual date of death. Remember that the death happens, the paperwork all happens, and the investigation happens, and then it comes through to us and it's reported in. So that's what she's looking at would be that collection or that date of death on there.
Yeah. I know we're running out of time.
5.
Yeah, I'll show it really quick before I know we're running out of time, but I'll show this anyway. This is what she's talking about. These light blue are the 52 that were added today. So you can see that while you're saying 5 deaths, and you are right, it's added right here, but we have this massive drop off that is going to be addressed. Like in statistics, especially when you're talking about behavioral statistics, you're not going to see an organic drop like this. This is an administrative drop. So these numbers are going to be filled in. So we're looking at some pretty higher death numbers coming up soon to fill this in.
So Jody, what that's saying is, let's see. I'm just watching for the governor, so I'm not distracted here. But as soon as I see him, we'll dip away. So what Garrett is saying then, Jody, is follow that yellow line. Where that yellow line ends, that's the last date that is stable in that chart.
Really, the safest way of looking at it. Prior to that, it's
because all of those light blue places are where it's being added in. So hopefully that helps, Jody, to answer your question. So when you're seeing the number reported in, don't confuse that for the number of the actual date of death, or in the case of cases being reported, the collection date of the sample. So those are the two things to keep in the back of your mind to help you better understand those numbers as they come out. And then, as Garrett, as you talked about, that drop off is going to be there till those numbers can be filled in, and that takes time.
Yeah, you're not going to see a drop off like that. You didn't see it anywhere else on the curve. It's not going to come up just organically, or it's not going to show up like that arbitrarily. It's going to self-correct eventually. It might take a couple weeks, but it's going to self-correct.
Right. And I know that's repetitive for a lot of people who watch us all the time on here. So thanks for bearing with me to sort of re-explain that, if you will. But it's so important to understand that, because that's where so many people were getting confused in that, and that's where we got a lot of questions. All right. Last few minutes, Garrett. Let's see. We have talked about the hospitalizations. We've talked about the overall numbers. We have not highlighted the case numbers across the U.S. So we had 180,000 2,000 cases reported in the last 24 hours. So that's just like what you see across Arizona as well. Those would then be plotted in on the collection date, but the actual reporting date, 180,000 cases across the U.S. reported in, and sadly, 2,597 American lives lost and reported in just in that last 24 hours. That has to be a record. That has to be a record day. 2,000.
I mean, I would think that now we're starting to get those administrative reports. As you can see, it's in Arizona's is now updated. So yes, it probably is a record because of all these. Everyone had a Thanksgiving holiday, so they're all being added.
Yeah.
National trackers today.
So would you say then when looking at national numbers for deaths and cases and all of these things that you're really going to have to smooth that line out and look at like a week to week or week over week chart to better understand if we actually had a dip, a rise, whatever?
Yeah, it's the same exact situation for everybody. Today it's not like we say, oh, it was a record day. Well, of course it was a record day nationally because of the Thanksgiving
record reporting day.
Yeah, okay. Record reporting, yes.
Yeah. Okay. Really good stuff. You know what? We are going to wrap it here just so we can get you guys all over to the other feed that's coming in as the governor's getting set up to get started. We don't know what he'll be saying, but we'll, of course, keep you updated tomorrow if you don't have a chance to stick around for this. I just want to remind you all the places you can watch it. If you're not staying here on Facebook, you can catch it live on ABC 15. So turn on your TV right now or live in our ABC 15 mobile app. Just wherever you are, we want to make sure that you have a couple different options for watching this. As we remind you, you can catch us on our Twitter accounts or on Facebook, whatever's easiest for you. Garrett_Archer is Garrett's Twitter account. A lot of really good information in the mornings coming out about coronavirus. Mine is @Katie Raml. If you prefer Facebook, mine is facebook.com/news from Katie. And then the very latest reporting on coronavirus found on our website, abc15.com/coronavirus. And our newscasts 4, 5, 6, 9 over on CW. I'll be anchoring that for you tonight, and then back on ABC 15 News at 10. So we will see you tomorrow. In the meantime, be safe out there, everybody.